Hey Melissa, it's Frank. Just doing a critique on your video. I'd like to say first off, I thought it was a pretty good video. You got through it pretty fast. That was good, because we got a lot of assessing to do on a patient. So the faster we move through it, the better. I did notice some things. We got to take note of things, and if we don't bring them up, then the critiques aren't done right. So I just wanted to share some of that stuff with you. The first thing I noticed, I was a little confused in the very beginning that you said you previously assessed the patient and then after you went ahead and introduced yourself. So I didn't know what that was. I think you meant that you were checking the chart because you did mention that. So I think that's what you meant. It's like you got a general assessment of the patient's well-being from the chart and then you went in there. So I think that's maybe what you meant. I was a little unclear about it, but I don't think it's going to be that big of a deal. If I keep looking down, I got notes that I jotted notes down. So you checked the chart. That was good. I think you forgot hand hygiene and privacy. When we're at the patient's side, it's probably a good idea to explain the procedure to them just so that they know what we're doing. And then when we do that, gain permission from them because we're going to have to touch their body. And some people might not be expecting that. I don't know. They may have thought you just came in there to talk to them, but I always thought it was a good idea to do that. So if it seems like I'm nitpicking, I'm not trying to. It's just for the sake of the critique. If we don't do it, you know how it is. So, okay. All in all, like I said, I thought you did a good job. Let me see. Oh, that's funny. I remember I made a note. You asked the patient how's their peeing. That's hilarious. I know what you meant. You're asking about their urinary, but that's just hilarious. So I know it was your son, so I just started laughing. It was cracking me up. So we'll move down the list here. I got a whole bunch of check marks of things that you were doing right. If I go through all of them, then we'll be here forever. So you did ask about the bowel habits. I thought that was, that was good. The spot on. You should be doing that. But we don't know what's normal for the patient. So if we ask, like, are you excreting bowel? Are you eliminating waste on a regular basis? And they say yes. Okay, what's regular? Because to them it might be a week at a time. They might not have an elimination for an entire week. So we might want to just find out, is it every day? Is it multiple times a day? That kind of stuff. So just things to keep in mind. It's kind of hard when you're doing like subjective questions because it's really up to you what you feel like you should be asking at the time. But for sake of videos, I'm just giving you some thoughts that I have. You're assessed for lesions and rashes. I would probably maybe, I don't know if it's necessary for this video, but I would think maybe ask about medications because some of them can cause constipation. Some medicines can change like the color of the urine and the odor and stuff. So it's as a adolescent, so it's less likely that would happen, but it is possible. So just in the habit of maybe asking that could be a good idea. And they're just pointers, it's not that you're doing it wrong. I like that you did your A&O times 3. I didn't even think of doing that in this video because it had pertained to a different video. But the truth is, the more that you bring that up, the better. So I really like that. I think I'm going to pick that up from you and start using it and everything. And I like that you used you asked the patient about their mood and you assessed it and you noted it. So that's good. That's a big plus. You checked for masses and bulges, but I didn't hear you state that they were symmetric, the left side versus the right side. You did note that there wasn't any masses or bulges, so that implies that it could be symmetric, but I think they're looking for us to say that it's symmetric. I feel like it's nitpicky, but we got to bring it up. When you were, you did a good job stating the 4 quadrants and all the organs that are in those 4 quadrants. I actually think I forgot to mention which ones were in there. In fact, I wasn't even sure if we were supposed to, but it seemed right when you did it. So I'll make sure that I do that on my head to toe. I would probably note that there's 5 to 30 bowel sounds that we hear in each quadrant. You did note that about the 5-minute rule. That's perfect. Right? And you noted that it's in all 5 quadrants if you don't hear sound. That was good. And I like that you noted about vein distensions and pulsations. I would probably note what you're looking for. Like, what does that mean with, what does it mean if you see pulsations? And in that case, that would be you're assessing for a AAA, basically. So maybe note that just so that the listener knows that you don't know just to look for it, but you know what that means if you did find it. When you were assessing, you said you were going to use the V, which is a perfect technique to assess, your aorta, your renal and iliac arteries. When you were doing it, you said you were going to listen to the kidneys. I think you meant the renal arteries. I fully believe that's what you meant to say. I wouldn't want you to get marked down because you can't hear the renal. I mean, you can't hear the kidneys, through the anterior abdominal area, but you can hear the renal arteries. I think that's what you meant to say. I just wouldn't want you to get marked down on a head to toe over it, because I know what you're doing. You checked it. So, as far as the rest of it, I think you did pretty good. I would maybe note like what it is, what you hear. You checked, you were auscultated and you did it in the right order. Maybe just note what it is that you're hearing. Is it a gurgling sound? You're hearing like little firing sounds in there, just so that the listener knows what you're hearing. Because these videos are being viewed by more than just us, because we put them on YouTube. So even though I know and the instructor knows, and obviously, the person who's watching this video for the very first time doesn't know what you're hearing, and they might actually be researching it to learn how to do it the right way before they do it. So I've looked up a couple things on YouTube just to see like what's the difference between mine and somebody else's, and I found that I like a lot of the things that I say, and then I kind of wish I had taken some of their stuff and maybe incorporated that into mine, or maybe I like the way they're doing their total head to toe. It's kind of giving me some direction to go, or I might say I don't like it at all. But when you know everything that you hear and that you see, it kind of helps everybody, because there's a whole lot of people that are going to school for nursing, and I know you're thinking about this, well, this is an assignment and I just got to get the assignment done, but I mean there's a lot bigger picture in it too, and I try to keep that in mind. I might not be right with it, but it's what I try. So all of your assessments are great. The only things that I would add upon exit would be ask the patient if they had anything else that they might want to address at that time. Because in that situation, the patient might just simply be like, oh, well, I was thinking I had this, I know you're assessing my abdomen, but, in real life, your patient might actually have something else they need to bring up. They might have pain, but it might be somewhere else, and that would be a good time to get that information from you. Probably share your results with the patient. I know you're a Russian, I understand, and when your memory's full, you can't fit a 15-minute video in there. I understand that. I totally do. Make sure you address washing your hands before you leave the patient's room, and then just state that you're going to document your findings. Like I said, I know you're Russian. I get it. I've tried to burn through some of mine, and maybe I didn't get them as fast as I was hoping. Well, I'd like to get mine in the 5-minute range where yours is at, but at this point in time, I seem to not be able to do that. But that's okay. At least I'm getting most of everything, and not everything, that's for sure. But remember that in real life, we're going to be Russian. We're going to have a lot of patients to take care of at one time, but every patient's going to need our very best from us. And they don't know the difference, right? They just trust us because they're in a vulnerable state. They don't know the difference. They're hurting or something's wrong and they're scared. And all they know is they got a nurse or student nurse that's there to help them. And whatever assessment we give them is what they get. And so if we're missing things, they don't know the difference. They don't know if they got a good assessment or not. They just trust that we're there to help them. So I understand, it is what it is. But all in all, you did a good job, and I definitely like how you just burned right through it, because that's That's the idea. We got a lot of patients to get to, and if we assess them all for an hour each one, well, you got 8 patients. You just didn't do anything the whole day but assess them. So you're on the right track with that. Good job. So, and I'd say you probably hit the majority of everything on there. So, well, good job. All right. Hope I see one of your next videos because I enjoyed it. Take care.